I'll talk about my biggest passion, which is academia and research. And I'm so privileged to also be the chief of academic research, of academic excellence and research at Lakeridge Health. I'm a huge believer in the value of academia, of knowledge, of transfer of knowledge, and at the same time of the role of research that it plays into what we really believe in, which is providing the best equitable and the best care for the communities that we serve. And I truly believe that academia, innovation, and research play a significant role in that. So when we look at Lakeridge Health, we look at it as a very important healthcare system serving the population in the Durham region. But in addition to that, if you come to Lakeridge Health, you will see the Learn Center. We have almost 3,000 students in our walls every year. We have the innovative MDFM program that Dr. Aziz will be talking about. We already have 60 students who will be coming out of this system and serving the community in the Durham region as family physicians. We have innovative partnerships with multiple organizations, including Ontario Tech, including Durham College, including Queen's University, University of Toronto, and they're all there. So what we are inviting all of you to look at is not only us as a very functioning, highly functioning healthcare system, but also a system which is embedded in academia, embedded in innovation, and also embedded in academic excellence. So you will hear from my colleagues what we have done at Lakeridge Health to serve our communities. Thank you.
Hi, everyone. So when we're talking about health equity, one of the things that is important for us to understand is that it requires everyone to have fair opportunity to achieving their best health, regardless of race, gender, socioeconomic status. And one thing we will say, just based on this panel that we have here, is that innovation in research, education, and community engagement is pivotal in addressing any disparities that do exist in achieving this. So when we say fair opportunity, sometimes the question is, how do we determine what is fair? And when we're saying fair, is it from the perspective of the healthcare providers, or is it from the perspective of the people that we're actually serving? And how do we, as healthcare providers, equip our communities, our patients, and their families to be able to engage and in determining what is fair? I'll share two examples with you. For instance, if we were to think about a newly immigrated mom coming in to Canada with 3 kids, no supports, just on her own, coming to our ED department, our youngest is sick, difficulty breathing, how do we identify what's fair to her? Or how does she know what fair opportunity is within a system that she does not know? Or when we think about a young Black or Indigenous woman who is in our healthcare system with excruciating pain, never been in our healthcare system, not knowing how to navigate it, how do we define fair opportunity for that person, or what does that experience look like for them? I think when we're looking at this, it's important that we realize that fairness, there is a requirement for us to look at our systemic situation a little different and veer from the normal paths that we've historically followed. And I say this because when we look historically at our women in our communities who have historically been, exploited or excluded from, say, research or educational opportunities, or even looking at, for instance, when you think about even our Canadian history, where we, during the 1920s to 1970s, had forced sterilization of Indigenous and Black women. These are things that have caused a lot of mistrust within our healthcare system. And so when we're thinking about this, how do we regain and build that trust within our communities? And I say, one of the things I am proud of in being a part of Lakeridge is that there has been concerted, focused effort in actually engaging our community. We see senior leaders, we see different leaders being in our community at events, at different groups to hear what our community members are saying, to bring that back. It's important that we are also thinking about how do we create groups and focus groups to engage community so that their voice is at the table. And when we look at our organization, we have committees where we have family members and patients being a part of those committees to ensure that decisions that we're making, the way we're approaching care, the policies that we're making are including those voices, because the inclusion of that is of utmost importance to us. We have our amazing medical school, and a lot of education, as Dr. Ismiil said, is actually happening at Lakeridge. And so when you're looking at bringing all those pieces together, and I have to give a shout out to our amazing research department that really ensures that we are taking into account the voices of the people, the end users, that will be impacted by the research we're doing. And so I want to just stop by saying nothing for us without us should be the motto that drives any innovation that we're doing when it comes to health equity. Decisions and policies affecting women, especially women who have been disenfranchised in our healthcare system, should not be made without direct involvement and input. Representation matters. Participation and self-determination is a requirement.
Hello, thank you. I'm Dr. Natasha Aziz. I'm a family doctor in Newcastle, as it was mentioned. And I have a question to start, which is, who in this room does not have a family doctor within half-hour drive of their house? Okay, see all the hands? So this makes sense because, as Dr. Tamirzi said, there's 80,000 people in Durham Region who do not have a family doctor, and there's 2.3 million people in Ontario. So Lakeridge Health and Queen's University have partnered to try and help address this crisis in our area. And so what we are doing is we have a new medical school campus, which is located right here in Durham Region in Oshawa. And we already have 20 students a year who are training to be family doctors right here in Durham Region. So we have 2 classes who are currently in, and we're in the midst of the admission process for our 3rd class. So as of September, we'll have 60 students. So this is great news for our region because really I think it's an important part of the work that Lakeridge and Queen's University are doing to help better meet all the health needs in our population, but especially women's health needs. Now, one of the unique things about family medicine training is family doctors are not an expert in any specific area of medicine. What they're actually experts in is experts in their patients and their communities. So a family doctor training program is focused on understanding all the different conditions that affect the life cycle from, babies, adolescents, adults and older adults. And we are also one of the few doctors that you can have for decades throughout their careers and really getting to know the patient as a person and their unique health needs. Now, when it comes to women's healthcare, there are some myths that I wanted to dispel about family medicine care. Many people believe that women's health issues will automatically require the input of a specialist, or they may believe that family doctors are not trained to address women's health issues. Now, modern family medicine training programs are absolutely focused on these things. Family doctors are actually experts in the life cycle transitions. That's how we refer to it. So that includes things like what happens in your life around puberty, and the education family doctors get actually extends beyond the medical elements, but also some of these family relationship, social workplace elements that can be impacted by transitions. And I'm sure many of you in the audience know those transitions are often the points at which many health issues will emerge. So
puberty, new parenthood is something we heard about today, and also the menopause transition and also aging and end of life. So definitely it is appropriate to bring any concerns to your family doctor. Another myth is that certain women's health issues specifically are too personal to bring to your family doctor. I can tell you as a family doctor, like nothing is too personal. So I just want to encourage you, if you are lucky enough to have a family doctor, to please don't hesitate to bring your health concerns to them. Sometimes referrals to specialists are needed and essential, but sometimes they can be not needed, and you may be delaying your care or causing discomfort by not bringing those issues to your family doctor. And then just to wrap up, I wanted to encourage you to visit our booth. Our booth has more information about some of the equity-driven admissions initiatives that we have at Queen's. We'd love if you know anyone who would be a good candidate for our program for them to apply. We need more family doctors in our community, as you know. Thank you.
I just wanted to thank you for having me tonight. I get to talk a little bit about the application of a lot of the work that's been spoken about so far. And so I just wanted to introduce something that really has been a community initiative, and that's robotic surgery at Lakeridge Health. And so what that means is we do have a very cool technical innovation that rolled down our hallway with a huge clap in and was really supported by so many of our clinicians. That's why I have slides, because surgery is a team sport, absolutely. And so this is really to speak about some innovative technology that is absolutely earth-shattering for a community hospital. We are on the map, we are large, and this just reinforces that as well. So last 2 years ago now, April, Dr. Francis, who you heard from, who's an absolute rock star on our team, did the first robotic gynecologic oncology case at Lakeridge Health. And this is Kathy, who was our first patient here as well. And some of the things, there's no speaking notes, so now I have to rely on my memory here and just sort of the teleprompter. But what this really meant in Kathy's words were, she said it was truly unbelievable to have a robot doing her surgery. And she really reflected on how she was able to go home the first day, and she noted a big difference in her experience in having this less invasive procedure versus previous operations that she'd had before. I have to give an absolute plug because we did 150% of the surgical volumes that we had planned to do in our first year of launch. So we gave the team a target and they absolutely knocked it out of the park. We didn't slow anybody down. We just kept driving towards the finish line. And that takes the whole team. So our finance partners who are here at the table, our senior team supporting that as well. Julie and I talk often, as do Chris and Tab. And our all-female gynecologic oncology, I'm trying to change your title, usually I just say our gyne oncology department, of 3 female surgeons did 40% of all robotic surgery that happened at Lakeridge in year 1. I don't think those were the 160-hour work weeks, but I'm not actually sure that we didn't rival some of those. And so I just wanted to show here, you will see there's Dr. Francis in our top shot there. I don't need to refer behind me. Dr. Elena Igwe is in the shot below her. And where I wanted to also thank our community, it's our community that made this possible. I see some of our foundation partners are here in the audience, and it takes a team fundraising across all of our hospital sites and community donors that have made donations that have made innovations like this possible as well. And we can flick to the next slide there. So what this means for our community and patients who are diagnosed with a uterine cancer and endometrial cancer is that they no longer have to travel outside of our region. Cindy said, our vision really is to bring all of that close to home to your own community hospital. You could go through that process with your family doctor, get referred to a local expert that's in the same Durham region here, and have your surgery. So I know we're working in our diagnostic department as well, and there's been huge innovations done there. Prior to the robot coming to Lakeridge Health, you would have had to travel to Ottawa or to Toronto to have this type of service, and you can see there on that nice, beautiful bar graph there. our volume of population is really quite high. And we were one of those kind of to the left hospitals with a large catchment, large population to serve that didn't have a robot. We can say today that we do, and we keep all of our community members cared for at home that need that service. The reason this is a huge technical innovation is also because it reduces your length of stay. You can go home the same day. Your complications are reduced. The need for you to have a blood transfusion during your surgery is reduced. And the chance that you'll come back to the hospital and need to be admitted into an inpatient bed is also reduced. Our surgeons have also noted there are many patients that they wouldn't have been able to operate on with this minimally invasive technology in hard to reach places without this approach. So it's really been life-changing for those patients. And because this is a Women in Health event, I just wanted to say this also helps us to recruit many world-class physicians who are trained in robotic surgery to Lakeridge as well, which cannot be understated when we're growing at the rate that we are and trying to keep a high caliber of talent with us. This is my plug to say I work on the program side. I brought the org chart because we're all women actually leading the surgical program on the program side, and so I think that's novel, and that's not to say that we don't have men leading surgery at Lakeridge, because my colleagues John and John, actually I could not lead the program without them, and they're absolutely integral. But I think the message here really is there is a large place for women leading healthcare at Lakeridge, and I think that's just evidenced by this team. And that may change. This may not always be the way we have welcomed men to our team in the past, and I'm sure we will again. But these are just some of the positions that we do have that are led by women, and so I just wanted to highlight that on the last slide to round us out today. Thank you very much.